Welcome to the Health Bulletin. Across the globe, we've tracked the emergence of mysterious illnesses, unusual health phenomena, and groundbreaking medical discoveries. Today, we're here to talk about a disease that's making a serious comeback. Recently, a concerning outbreak of Lassa fever has emerged. The Nigeria Center for Disease Control and Prevention reports a significant spike. In just the first 6 weeks of 2024, there were 411 confirmed cases, and sadly 72 lives lost across 21 states. By week 6 alone, the number of cases rose to 83, indicating a concerning trend. Before we move forward, if you're finding this content helpful and informative, please consider hitting the subscribe button below. Lassa fever is a type of zoonotic disease that can be transmitted between animals and humans. It's a serious viral illness that can cause bleeding and occurs mainly in West Africa. After being exposed to the virus, it can take anywhere from 2 to 21 days for symptoms to appear. This illness brings about symptoms like feeling weak all over, coughing, feeling sick to your stomach, throwing up, having diarrhea, muscle aches, chest discomfort, and in severe instances, unexpected bleeding from the ears, eyes, nose, mouth, and other areas of the body. The Lassa virus is transmitted to humans via contact with food or household items contaminated with rodent urine or feces. In many cases, infections can spread from one person to another, and transmission can also happen in laboratory settings. Especially in hospitals that don't have enough measures in place to prevent and control infections. Lassa fever is known to be endemic in Benin, Ghana, Guinea, Liberia, Mali, Sierra Leone, and Nigeria, but probably exists in other West African countries as well. The overall case fatality rate for Lassa fever is 1%, meaning that out of all reported cases, 1% result in death. However, for patients who are hospitalized with severe cases of Lassa fever, the observed case fatality rate is higher at 15%, indicating that 15% of these severe cases result in death. The most affected age group? It said the predominant age group affected by Lassa fever was 21-30 years. The agency said 65% of all the confirmed cases were from Ondo, Edo, and Bauchi states, while 35% were reported from 17 other states. The NCDC announced this on its official website on Thursday. Reports indicate that the number of new confirmed cases increased from 70 in week 5 to 83 in week 6. Sadly, there were 9 deaths recorded during week 6, which lasted from February 5th to February 11th alone. The agency reported that in 2024, the number of suspected cases decreased to 2 to 122, compared to 8.280 reported for the same period in 2023. And 2 new health workers were affected in the reporting week. The NCDC announced that they've activated the National Lassa Fever Management System to coordinate the response efforts across all levels at the Emergency Operations Center. The agency also listed some of the challenges it faced in its fight against Lassa fever across the country, to include late presentation of the cases and poor health-seeking behavior due to the high cost of treatment and clinical management. Other challenges, it said, were poor environmental sanitation and poor awareness observed in high-burden communities. People are also advised to stop bush burning, avoid eating rats, and not to touch any surface touched by an infected person. They have also advised people to maintain high level of personal and environmental hygiene, such as covering their food and utensils properly. Thank you for watching, and if you enjoyed this video, make sure to subscribe to our channel for the latest in medical breakthroughs and health alerts.